Welcome to our presentation on Connecting Care. Connecting Care is a model, and it was created by Mentor Research Institute, which is a 501c3 nonprofit. Connecting Care was designed for two primary purposes. One is to create connections between physicians, community, and mental health professionals. The second is to build a collaboration and the necessary infrastructure to assure coordinated and accountable care between a private practice physician group and independent mental health professionals. Connecting Care was also designed to solve four problems. The first problem is this: there are no systems or models in Oregon that can provide coordinated and accountable care between physician groups and independent mental health professionals. So what is coordinated and accountable care anyway? Well, it involves at least 9 key elements. It involves health information exchange, consistent and reliable measures, uniform screening and outcome measurement, ensuring that patients have reasonable and timely access to care, creating a positive patient experience, using empirical or at least evidence-based treatment, improving patient physical and emotional health, but also improving a community's physical and emotional health, and managing, or at the very least, containing costs. The second problem is this: there are no independent mental health practice groups in Oregon that can provide coordinated and accountable care on a wide-scale basis that is compliant with licensing requirements and state and federal regulations. Why? Well, there's at least 3 primary reasons. First, mental health professionals are not allowed to organize and to collectively set fees and contract with insurance companies. They certainly can't contract with employers. Second, the government gives money to physicians to pay for electronic infrastructure and to provide coordinated and accountable care. And third, many mental health professionals are not motivated and often resist organizing and forming provider groups. 3, many mental health professionals do not want to work with physicians, or they just don't know how to provide coordinated, accountable care in the age of the Affordable Care Act. And the question again is why? Well, there's at least 4 primary reasons. First, independent practice mental health professionals want to remain independent. They also want to practice in total privacy. They do not want other people controlling the services they provide, and many have limited training and experience working with physician groups. But some mental health professionals want to work with physicians and to provide coordinated and accountable care. And the question is, why is it so difficult for them to do this? To answer the question, we need to look at how physicians and mental health professionals are actually organized. So let's look at a large physician group such as Ben Memorial Clinic. And how are they organized? Well, they have specializations that include family, internal, geriatric, oncology, and general surgery. They have practice administration, a CEO, a CFO, line directors, nursing. They're organized. They have IT departments, electronic health records, referral departments, and billing. They have business plans. They have the electronic infrastructure to provide coordinated and accountable care, and they have similar standards of care. And they also have coordinated internal and external referrals. Now, what do physicians often assume about mental health professionals? Well, they assume that we might look like and operate a little bit like they do, that we're licensed, we know each other, we're semi-organized, we have electronic infrastructure, we have similar standards of care, and we know how to provide coordinated and accountable care. Well, none of this is actually true in most all cases. In reality, mental health actually looks a little bit more like this. It's a group of colorful people with different orientations, different approaches for the same problems, and it's really unclear who does what to physicians and the community, actually. So what else do we know about independent mental health professionals? Not everyone is licensed. They are loosely and informally organized. They do not have the electronic infrastructure. A subset want to collaborate with physicians, and many do not know how to provide coordinated and accountable care. Problem 4. Hospital-based medical care systems that have an integrated behavioral health department have real advantages over independent mental health professionals. What are the advantages? Well, there's at least 6. They have centralized appointment scheduling. They have internal referrals to social work, primary care, ER, neurology. They have interoperable electronic mental health records and electronic health record portals. They have peer consultation and review. They have progress and outcome measures they can agree on. They have electronic billing and auditing. Now, I'm going to switch gears here. The referral process is an important part of providing coordinated and accountable care. And the current referral process has many serious problems that are impediments to mental health professionals being able to adapt. So what are the problems with the current referral process? Well, let's take a large physician group, and let's also take a look at a hospital-based medical center, such as St. Charles. Now, St. Charles has done something very interesting in that they've created their own internal behavioral health department because they have the finances to do that and the determination. They can provide their own internal referrals from their primary care medical home. They also can accept a few external referrals, but basically their clients include hospital employees, Medicare, Medicaid, state health plans, Tri-West, and some commercial insurance. So let's look at the independent mental health practice community. Well, St. Charles can make some referrals, but essentially a referral into the mental health community is a bit like this. It's hit and miss until you find the right professional. Secondly, organizations like Ben Memorial Clinic, large physician groups that don't have internal mental health departments or behavioral health departments, could try to make referrals to organizations that have internal departments. That doesn't always work out so well because they're quite busy dealing with the contracts they have and the limited staff they have available to them. So, clinics then refer to the community, and this is essentially what it looks like. It's often hit and miss until the patient actually finds the person that's the best fit for them for their problem. Now, there's another phenomenon that physicians often refer to as this. It's called the black hole. And when a physician makes a referral into the mental health community, the patient goes in for the referral and then is never seen or heard from again. So the result is this, often this, that physicians are reluctant and don't have time, or they struggle when they refer to independent mental health professionals. Why do physicians need to make referrals in new ways? This is an important question, because being accountable means that physicians can't continue to profit from treating the medical consequences of behavioral and mental health problems that are not being treated. So, when you think of it, how many potential referrals are there from physicians to mental health professionals? Well, we've got really good research on that. If you take a look at the potential referrals, we know the rate of undiagnosed mental health problems in primary care is between 20 and 40%. We also know that as many as 75% of all patients who see physicians will report physical symptoms and mental health symptoms at the same time. And of these people, 16 to 32% of all patients who seek medical care and describe physical problems have no physical or medical cause and in fact have an underlying mental health problems. That's a lot of mental health problems being treated for what appears to be a medical problem. So, what are the challenges of creating an independent practice association? In other words, why can't we change this into this? Well, here's why. When you take a group of mental health professionals and you introduce the concept of a practice association, there's a number of benefits that you can present to the practitioners: mutual referral, peer consultation, developing training, and peer support. There's also problems. You can't set the same fee. You can't contract as a group. You can't collectively bargain. So what happens next? Well, this is what happens. Most of the people don't want to join, but a few do. But because this isn't a viable entity, eventually over time people start to leave, and I think that person left town and became a computer programmer. So moving on, the bottom line is this: mental health professionals must adapt because change is already happening. Health insurance is changing, standards of practice are changing, technology requirements are changing, and how to get paid is getting changed. So what's the best way for mental health professionals to adapt to healthcare reform, provide coordinated and accountable care, maintain and strengthen their practice, continue to receive referrals, improve the health and well-being of clients? It's by collaborating with physician groups. Now we have to ask, how do you do that? Well, Connecting Care has 4 necessary elements in order to do that. The first is you need a physician group that's willing to make referrals and needs to make referrals. And then you need mental health practitioners in a community, which we have in Bend. Physicians need to make referrals. How do we create the connection? How do we provide coordinated and accountable care? The answer to that is what we need to do. In order to do that, we have to have screening, referral, and outcome measurement software that everybody agrees to use. We then have to have a practice management system. And then we have to provide training in the Connecting Care model, which we're starting today. The next thing that has to happen is we have to create what's called a bridge, or an electronic infrastructure that can potentially connect mental health professionals with a physician group. Then we need to introduce the idea of an independent practice organization. This gives the organization a voice, or a central way of dealing with and collectively providing services. We then need a strategic collaboration, which we have. Once you have this strategic collaboration, we have a viable practice organization, which is then easy to populate with mental health professionals who are interested, and those who aren't can continue private practice mental health. But at this point, we've created what is now called independent practice integrated mental health care. And at this point, a few more people are going to join. Now, why would mental health professionals collaborate with physicians? There's 2 reasons. Because insurance companies are contracting with physician groups that can ensure coordinated and accountable mental health care. That's the wave. Secondly, physician groups are required to provide coordinated and accountable care in a measurable way to maintain their state certifications as patient-centered primary care homes and NCQA certifications as primary care medical homes, and to get reimbursements from the federal government. And there are some implementation issues that we're going to have to address. What must happen to provide coordinated and accountable care? Well, there are 7 steps. Create a strategic collaboration with a physician group, identify mental health treatment issues and goals for screening and referral, and the most important ones right now are depression, anxiety, tobacco use, high blood pressure, hypertension. Then we need to invite mental health professionals to participate in Connecting Care, provide training for mental health professionals, form an independent practice alliance, which we're looking at the model of AMHA, and we need to adapt software to provide professional, or to meet the professional preferences. And then we have to create what's called a HL7 or a CTS secure internet portal. Well, all this is ready to do. So, there are 9 processes here in providing coordinated care. Physicians can choose to provide internal screening and referrals themselves, or they can choose to refer patients to the online screening and referral system. Patients can be then screened and referred online and then evaluated and treated by an AMHA member. Care is coordinated electronically. Accountable measures are pushed from the electronic medical health record to the physician group's electronic health record. A database is now available to support incentives and reimbursements, and PCMHs and PCPCHs can support their certifications with measures. Let's move on. So, are there any added values that Connecting Care might provide? Yes. It provides online screening resources for practice building. So let's look at physician groups as a referral source. And let's look at the local community and population of Oregon. With an independent practice association, as physician group and the collaboration matures, the number of mutual referrals back and forth is going to increase. And as community awareness grows, referrals from the community and the population of Oregon is going to increase. And then as professional awareness grows in other healthcare related professions, the number of referrals are also going to increase. So let's look at Connecting Care. Again, how does Connecting Care support risk management? It's not actually increasing risk. We believe it's actually going to reduce risk. It does this through 5 risk management elements. There's comprehensive screening and risk analysis. There's stress-free financial auditing available. It has full HIPAA compliance features. It meets all state and federal regulations regarding protected health information and billing. And mental health professionals control their patients' healthcare information. So let's summarize this. Connecting Care is a comprehensive practice management, electronic mental health record, and billing solution. It's also a practice building tool, and it generates referrals. It's also a coordinated and accountable care design. It has a risk management system, and it meets licensing standards and state and federal regulations and laws. I hope this has been helpful.